as my MVP. You mentioned earlier, Premier, and I agree with you 100%, that everybody in our society should be safe. Well, I have a little secret for you. I'll tell you who isn't safe in our society. As Shirley mentioned earlier, it's the elderly. There's a dirty little secret going on in our hospitals as well as our long-term care facilities. And I should know, because I lost both of my parents at the Ottawa Civic Hospital due to neglect. My mother died from a stage 4 bed sore, the size of a golf ball, that was caused at the Ottawa General Hospital. My father died as a result of not receiving a CT scan because of a brain hemorrhage he had encountered. And the doctors knew that my father had a stroke because it was written in the clinical records. So when we talk about abuse, it's not just sort of something bad that happens to the elderly. It's actually a criminal event. It could be prosecuted under the criminal code. So my question to you is, you seem to be very, very concerned about women's rights. I have no problem with that. About Islamophobia, I don't have a problem with that. Of keeping everybody else safe in our society. Well, how about keeping our damn elderly safe in society? Because I'm our full-time parents. Okay, so this is not an academic exercise for me. It's not a, and I worked for the Ministry of Health for 18 years. And I remember with George Smitherman, the rudest bugger who was the Ministry of Health, crying on the front of the Toronto Star in 2003 after Moira Welch's article about what's going on in the healthcare system. That was 15 years ago, and nothing's being done. And I'll tell you, it's not just going on in our long-term care facilities. It's going on in our hospitals. They wanted to starve my mom to death after she had a stroke. And my brother and I, a former CBC reporter, Danny Globerman, we had to advocate against the doctors not to starve my mom to death. They were pressuring us. So my question to you is, pardon me for my emotion. I'm not upset with you personally. I'm not upset with you personally. But I work for the Ministry of Health. I know the way the place operates. You need to do a cleanup job and get rid of these clear commissioners. We don't give a damn about the people in the hospitals. And I don't want to hear that hospitals are independent facilities and run themselves. That's not the answer. Ministry of Health is a system manager. It's got to be cleaned up.
So I'm not going to say that we don't have to take responsibility for the kind of thing that you're talking about. And those situations that you have identified are horrific and shouldn't happen. And I absolutely agree with you. You know,
last March I was attacked by a security guard with a loaded needle full of sedatives. A security guard with a loaded needle full of sedatives at the General Hospital.
So let me just say, you know, you said that, you know, there are certain people in the society that I care about. That is actually not true. I actually care about a full range of people in this province. My father's 91 and my mother's 89. I know how vulnerable. I know how vulnerable people are at the end of their lives. I know that there is so much more that we can do, but to say that there have been no changes is it's just not true. There have been changes. There is more regulation of the places that our seniors are living. There are more inspections. There is more vigilance. There is an upgrading of those places, of those beds that seniors are living in. There's a creation of hospices across the province and palliative care. I mean, we have made huge, huge changes in the healthcare system since we've been in office. Are we done? No. There is so much more that has to be done. And as our society ages, as we live longer, as we're healthier longer, this is a challenge that we are going to have to confront, and we're going to have to confront it together. So I'm going to end now because I know that I'm getting the hook here. I'm going to thank you all so much for being here. And I know that there are lots of strong feelings about the subject. That's why I'm here. That's why I'm here, because we have strong feelings about the things that we believe in. I need to hear those.
You're destroying
and I need to understand the issues. I'm going to be in Thunder Bay on the 31st of January. I'm traveling around the province because although the issues are similar from community to community, there are differences. I've heard some